Rough sleeping in England has risen by a fifth in a year, according to new snapshot estimates branded devastating and shameful. There were an estimated 4,667 people sleeping on the streets on a single night in autumn last year, according to annual government statistics. This was an increase of 769 people, or 20%, on the previous year's snapshot estimate of 3,898. The latest figure is more than twice the number since the estimates, the latest of which are based on a single date in October or November chosen by local authorities, began being recorded in 2010 when it was 1,768, while the latest figure remains just below the peak in 2017 when it stood at 4,751. It is the third year in a row the number has risen. Earlier this week, the government announced it was doubling emergency homelessness funding for councils in England to £60 million, but the national membership body for frontline homelessness charities urged a wholesale review and reset of homelessness funding. Rick Henderson, chief executive of Homeless Link, said it is beyond devastating and shameful that our society has allowed thousands upon thousands of people to face the trauma of sleeping rough across this country. The organization blamed a welfare system unfit for purpose, an acute shortage of truly affordable housing, extremely overstretched homelessness, health and social care services, and a disconnect between government policies, from hospitals and prisons discharging people onto the streets to people leaving the asylum system with nowhere to live. Mr. Henderson added, Homeless Link is calling for a wholesale review and reset of homelessness funding that can enable support to be turned on its head. We desperately need a more efficient and effective funding approach that can drive a system rooted in preventing people's homelessness and provide support to make sure that everyone has a home and the help they need to keep it. Big Issue founder and crossbench peer Lord John Bird said the latest rise is simply unacceptable and described rough sleeping as our nation's biggest source of shame. He said while higher spend on emergency funding is welcome, it must not be mistaken for a solution to this crisis, adding that clever thinking, long-term investment, and collaboration on a huge scale are needed. Separate figures published on Thursday showed the number of children in temporary accommodation hit a record high of 164,040 as of the end of September. The number has risen 15% in a year and is the highest since records for this measure began in 2004. The number of households in temporary accommodation was also at a record high of 126,040, having increased 16% in a year. There were 5,400 households with children living in bed and breakfasts, B&Bs, by the end of September last year, a rise of 15% in a year. Some 3,470 households with children had been in B&Bs for more than the 6-week limit. By law, B&Bs are meant to be used only for families in an emergency and for no longer than 6 weeks. The figures came as the Local Government Association, LGA, said funding changes mean councils have up to £76 million less to spend on temporary accommodation for households facing homelessness compared with last year. It said while it is right that the government has increased its focus on prevention and relief of homelessness, what it described as a sudden shift in funding allocation has increased the financial pressure faced by councils at a time when costs of temporary accommodation are soaring. Adam Hugg, LGA housing spokesman, said, an uprating of the temporary accommodation subsidy is desperately needed to address the significant and growing cost pressures faced by councils. On Tuesday, an extra £30 million in emergency funding was announced for councils in England to help keep people at risk of eviction in their homes and support rough sleepers off the streets. The money was allocated after Deputy Prime Minister and Housing Secretary Angela Rayner said remaining funds in her department should be directed towards tackling homelessness. The Ministry of Housing, Communities and Local Government said the announcement amounted to a doubling of a previously announced £30 million for winter pressures funding for homelessness. Asked about the record high number of children in temporary accommodation, a Downing Street spokesman said, it is totally unacceptable that so many children are waking up in temporary accommodation. We've addressed this before. A minister previously has described it as inheriting a homelessness crisis, and it's absolutely crucial that we do tackle it. And that's what our plan for change is all about. The government's latest rough sleeping statistics reveal a shocking 20% increase in rough sleeping in England, with the number of women seen sleeping on the streets keeping pace with this, from 568 in 2023 to 680 in 2024. And this number is likely to be an underestimation, with hidden homelessness particularly common among women. We know that homelessness is terrible for people's health, and the evidence tells us both that women experience homelessness differently to men, and that across the population, women face different health challenges. Therefore, to effectively address women's homelessness, we need gender-specific responses. Data from Homeless Health Needs Audits, which feed into our Unhealthy State of Homelessness report, reveals that despite a high predominance of poor mental and physical ill health across the board, there are differences in the health challenges faced by women experiencing homelessness compared to men, and in the ways that men and women access health care. Our data shows that slightly more women than men have a diagnosed mental health condition at 85%, 128 for women, and 82%, 259 for men. While this is reversed for physical health conditions, at 81% for men versus 78% for women, there is variation within this, with women more likely to have a diagnosed urinary problem, infection, or incontinence, 18%, compared to men, 8%, and more likely to have an asthma diagnosis, 27% of women versus 20% of men, 23% of men. Despite this high level of need, women are more likely than men to report not having received an assessment or treatment when they had needed it in the last year. And this is particularly the case for mental health services, 44% of women versus 34% of men. Though the data does not explain why this is, it does suggest that women face distinct barriers to accessing care when compared with men. Parents of children at a primary school in Nottinghamshire say they are concerned about pupil safety after an encampment used by rough sleepers appeared just steps away from their school. The arrangement of tents, shopping trolleys, sheets, and cuddly toys sits opposite Roundhill Primary School's infant entrance in Beeston Library. Broxtowe Borough Council said the encampment had been causing concern in the community, but it was unable to remove it as the land was owned by Nottinghamshire County Council. The County Council said it would monitor the situation and take action to provide an appropriate solution. Nottinghamshire-based homelessness charity Framework said 2 rough sleepers were initially at the site, but its teams had been unable to engage with them. Anyone who has been driven to sleep rough is clearly in need of help. However, these particular individuals would evidently prefer to be left alone. The charity added, the site has been active for around 6 months. Parents told the BBC they had found needles, blood-stained tissues, and feces in the area, although it has not been confirmed if this is linked to the encampment. Jessica Baker's 6-year-old son attends the school, and the pair walk past the dwelling every day. She said, I understand that people live like this and have nowhere else to go. We are sympathetic, but outside a school is not the right place. There's cuddly toys in there. What if our children runs up to them and put themselves in danger? All of the children who use the entrance are aged 4 to 7. Another parent, Helen Wilson, said she worried about the impact on the community. It started as 1 tent, then 2, and the camp started growing more and more. It is attracting littering in the area, she said. This is a difficult situation and nobody wants to deal with it, but we have to put our children's safety first. One parent, who wished to remain anonymous, said they saw feces in the area 3 weeks ago. Should a child have to see something like that on their way to school? They said. We just want it removed. Everyone's pointing fingers at whose responsibility it is, and it's getting ridiculous. In a statement, Roundhill Primary School said, we are aware that those sleeping rough are vulnerable individuals facing difficult circumstances, and we believe they deserve support. However, we must acknowledge the impact this situation is having on our children. There are growing concerns about hygiene and safeguarding. We urge those in positions of authority to take effective action to find a solution that supports both the individuals affected by homelessness and the well-being of our school community.